If you're one of the millions of people who hear that constant ringing, buzzing, or hissing sound that nobody else seems to hear, you know just how maddening it can be. It often gets brushed off. But what does the science actually say about it? Well, let's dive in and find out.
Ah, yes, this old line. For anyone dealing with tinnitus, this phrase is probably painfully familiar. It's what you hear all too often, and honestly, it can leave you feeling completely hopeless and dismissed. But is that really the end of the story? Do you just have to live with it? Absolutely not, and the evidence says so. We're going to dig into the actual clinical guidelines to see what science really says about managing this thing effectively.
Okay, first things first. Let's make sure we're all on the same page. What exactly is tinnitus?
Now, here's the most important thing to get right away. Tinnitus isn't a disease in itself. It's a symptom. But man, as a symptom, it can be incredibly disruptive, messing with everything from your sleep to your ability to just concentrate.
And get this, we're not talking about some rare, fringe condition. We're talking about an estimated 10 to 15% of adults in the US alone. That could be more than 50 million people. It is one of the most common health conditions out there.
So, if it's a symptom, that begs the big question, right? What's actually causing it? Well, the answer is a little more complicated than you might think. So doctors basically break tinnitus down into two main buckets. You've got secondary tinnitus, which means it's a symptom of something specific and identifiable, like an ear infection or even just earwax buildup. But what most people have is primary tinnitus, where there's no obvious cause other than a likely connection to hearing loss. And that link between tinnitus and hearing loss, it's huge. The most common culprit by far is hearing loss, usually from just aging or, you guessed it, exposure to loud noise. The leading theory is pretty fascinating. It's that when your brain stops getting the sound signals it's used to, it kind of panics and cranks up the internal gain, creating its own phantom noise to fill the silence. But hold on, the cause isn't always about a loud concert you went to 20 years ago. Sometimes the trigger could be hiding in plain sight, maybe even in your medicine cabinet.
You might be surprised to hear this, but more than 600 common drugs are considered ototoxic, which is just a fancy way of saying they can be harmful to your ears. We're talking about things like high-dose aspirin and ibuprofen, certain antibiotics, and even some antidepressants. For a lot of people, it's temporary, but for some, it can be permanent. Okay, so you have this ringing. What should a proper, evidence-based doctor's visit actually look like? What should you expect to make sure you're on the right track from the very beginning?
The clinical guidelines are super clear here. A good evaluation kicks off with a detailed history. Is the sound in one ear or both? Is it pulsing with your heartbeat? Then comes a physical exam of your head, neck, and ears. And this is the big one. A prompt and complete hearing test is an absolute must to check for any underlying hearing loss. Now listen up, because this is a really crucial point. The guidelines give a strong recommendation against getting routine MRIs or CT scans for your typical non-pulsing tinnitus that's in both ears. Why? Because the chances of finding anything serious are incredibly low, and this recommendation helps you avoid a whole lot of unnecessary anxiety, radiation, and, let's be honest, cost.
All right, now for the part you've been waiting for. We know what it is, we've looked at the causes, we know what a good doctor's visit should look like, so what does the science say we should actually do about it? Okay, here are the official do's. The guidelines recommend getting your hearing checked for a hearing aid, which is huge if hearing loss is a factor. They also strongly recommend something called cognitive behavioral therapy, or CBT, along with good old-fashioned education and counseling. Sound therapy is also on the table as a good option to explore, but notice, none of these is a magic pill. It's all about management. And just as important is the list of don'ts. The experts recommend against using meds like antidepressants specifically to treat the tinnitus itself. They also give a thumbs down to dietary supplements like ginkgo biloba or melatonin. Why? Because there's just not enough solid evidence to show that they actually work. So let's zoom in on those recommended strategies. This is how you really move beyond just gritting your teeth and living with it and start to actively take back control. So what on earth is CBT? Well, it's a type of therapy, but it's not about making the sound go away. It's about changing your brain's reaction to the sound. It teaches you to identify those negative, spiraling thoughts, to reframe how you think about the sound, and to develop real coping skills. The ultimate goal is something called habituation, where your brain basically learns to file the sound away as unimportant, kind of like how you tune out the hum of a refrigerator. So let's just boil it all down. This summary really brings the top 3 strategies together.
You've got hearing aids, which bring in more of the outside world's sounds so the internal tinnitus sound isn't so front and center. You have sound therapy, like a white noise machine, that gives your brain something else, something neutral to focus on. And then you have CBT, which tackles the anxiety and stress head-on. These three things, they are your evidence-based toolkit.
So, look, while there might not be a single magic cure for tinnitus just yet, the idea that you just have to suffer in silence and learn to live with it is completely outdated. There are real, effective, science-backed strategies to manage it. So the real question is, now that you know all this, what's the first step you can take?